Tonight, we're taking a closer look at a very common medical condition that affects thousands of people, but it's still very widely misunderstood. It's called chronic venous insufficiency. CVI happens when your leg veins become damaged and can't work as they should. We've even learned that President Trump has been diagnosed with CVI. Well, tonight I talk with Dr. Jake Hemingway with UW Medicine about what CVI is, how it's diagnosed, and the treatment options people have. Thank you for being with us on Arc Seattle. It's a diagnosis many of us have probably never heard of until today. What exactly is chronic venous insufficiency?
Yeah, of course. Thanks for inviting me. Chronic venous insufficiency is a really broad spectrum of things, but is one of the more severe manifestations of chronic venous disease, which involves a variety of signs and symptoms that occur when there's abnormal flow within the veins, especially of the lower legs.
Okay, is this a pretty common thing?
Yeah, it's very common. Actually, it's probably estimated that 1 in 20 people in the United States have this. So that's about 5%. And if you look at the most severe forms where it's associated with leg swelling, heaviness, or other skin changes, that might be as many as 2 or 3 million people having the most severe forms of chronic venous disease.
Is it something that just kind of shows up, or is it as a result of any other medical issues?
It can be both. A lot of people, it's genetic, family history of varicose veins. It can be the result of things like pregnancies or prior blood clots in the veins causing vein and valve dysfunction. But ultimately, it can be the cause of others, more broad systemic issues or other disease processes like heart failure, obesity, obstructive sleep apnea, and things like that.
So for those who maybe it's if those who don't have a genetic issue tied to it, maybe it is obesity. Are there things that we can do to make sure that we are less at risk for something like this?
Well, I think the biggest things is recognizing the signs and symptoms of it. And so when you have either visible varicose veins and associated pain in your legs, like aching and heaviness or swelling of the legs, it's most important to make sure that it's not something else. So if you have leg swelling, or most importantly, you have, for example, a wound that just won't heal, those are things where you really want to make sure that you don't have some underlying diagnosis that might be more serious. But figuring that it's all okay and that you end up with the diagnosis of chronic venous insufficiency, by far the way to prevent progression of the disease process is through the use of compression stockings. Other things that help are daily exercise, like walking. The calf muscle is particularly important for the function of the veins. And so walking and having good physical exercise, in addition to compression, are really the best things to do to try and prevent the problem from getting worse.
If we think that we might have it, was there a certain doctor we should be calling?
Yeah, so one way to start with this is to go to your primary care provider and just ask, does this look like a problem with my veins? Alternatively, vascular surgeons are among the many that treat vein problems. It's not a particularly specific thing, that there's a specific kind of doctor that only does venous work. But that being said, vascular surgeons, cardiologists, and others all treat vein problems. So a vascular surgeon would be a great place to start.
A lot of people, especially guys, like to put stuff off. Could it be dangerous if someone were to put this off and not get it checked out?
So for the vast majority of patients, it's not. It's unsightly veins that might be associated with heaviness or aching and swelling. But as you start to see skin changes, such as skin darkening on the inside of the ankle or skin thickening where the skin really starts to feel leathery and rubbery, those are signs that you are at a higher risk of progressing to the most severe form of chronic venous insufficiency, which includes venous leg ulcers, which are very challenging to heal and obviously associated with pain and other things that come with wounds. And so with those things, you definitely want to, if you see those signs and symptoms of skin changes or discoloration, you definitely want to be treated or at least evaluated and talk about treatment with a doctor.
Okay, and as we talk more about this, because it's going to be in the news for a little bit, is this really something to be worried about, or is this just another reminder for all of us just to make sure that we're in tune with our bodies?
I think most importantly, it's another reminder. This is something that a lot of people live with and have no idea that they even have. And it's something that can cause a lot of significant impairment in your daily quality of life, because a lot of people, sure, we might have desk jobs, but many people are on their feet all day walking around. And by the end of the day, they're having to stop and put their legs up. Their legs feel painful, their legs are tiresome, and there is a very easy treatment option for these conditions that is really an outpatient procedure, a day sort of thing that can be done under no anesthesia in many cases. And it can really restore a lot of quality of life. And so these are things that can really bother people that if you're not aware of it, you're just suffering for no reason.
Okay, this is all very good information. Thank you so much for spending time with us and letting us know all this information on ARC Seattle.
Yeah, of course. More than happy to help. And again, I'm just happy that chronic venous insufficiency and good vein care is starting to come to light so everyone can take care of their veins.